I'm the respiratory lead here in Galway for the Galway City Integrated Care Hub. That means I have responsibility for setting up the Enhanced Community Care programme for patients with 2 respiratory chronic conditions called COPD and asthma. Every Tuesday we come to my Cullen and we offer a one-stop shop for patients. When patients come to my Cullen, they get their breathing test done first by the physiologist. This is where we look at the amount of air that they can breathe in and out of their lungs. When that test is done, then they see me. And then with the results of the breathing test that they just had, I can make a diagnosis of COPD or asthma. The patient then goes on and sees our respiratory clinical nurse specialist and our respiratory physiotherapist. Prior to this, GPs would refer patients with a query diagnosis of asthma or COPD to the acute respiratory services. Patients were often waiting over 3 years to access that breathing test and to access a specialist. Now, GPs can refer directly to us in the Integrated Care Hub. We triage that referral and we will arrange for that patient to be seen in the coming weeks.
I came to the service in the early summer. I'm asthmatic and have been for the last 15 years. It's been an excellent service. I've been able to have that one-on-one service with the professionals. Just the convenience of being able to come out here as well, with the traffic and the less anxiety about parking in the main hospital. The follow-up plan when I left was absolutely brilliant. I left here with not having to return, having the proper inhalers, the proper technique and the proper equipment to use. From attending the service, I'm on the right path with my asthma. So overall, it's been an excellent service.
My role here is to ensure that all patients fully understand their diagnosis following consultation with the consultant. I go through the patient's treatment plan in detail. I look at their inhaler techniques and make sure they're doing it correctly. And I also answer at this point any questions that they may have.
My role is to educate and treat patients in airway clearance techniques, breathlessness management, restoring normal breathing patterns, and individually prescribing exercise programs.
This has been an absolute game changer for patients. Previously, they were waiting a number of years to even access a respiratory specialist. Now they know they'll be seen within a number of weeks. They can see us here in my Cullen Primary Care Centre. They have no problem parking, and they can get a diagnosis and a treatment plan all in one visit.